He wants you to want him. Cheap Trick, Muskegon's 100.9. Andy, it is 8:06 on your Tuesday as everybody tries to make their way in. If you're heading over toward GR, give yourself a little extra time. That big accident on 131 South at 96 has got things tied up over there as they're working on a fuel spill cleanup. So be on the lookout for that if you're heading over that way. All right, so it starts off like this. Last week, somebody put up on my Facebook page that their brother was in need of a heart transplant, and they were having a community garage sale to raise a little bit of money to help this guy out. I mean, who doesn't need a hand when it comes to something as big as a heart transplant? Scary stuff. Well, about 5 minutes later, I see a window pop up on my Facebook page from somebody named Stevi Riel, and I'm like, who is Stevi Riel? So I looked at it, and you are part of a big nonprofit here in town that people might know about that, you know, if the guy's looking for a heart transplant and needs some resources, you guys can help.
That's true.
It's through...
We're the Muskegon Community Health Project.
Okay.
We're the community benefit ministry of Mercy Health, so the local health system.
Sure.
And we're an organization that helps people get access to the health resources that they need.
Okay.
Whether it's maybe medication or help getting a physician, help getting connection to needed community resources. Things that can really help somebody stabilize when they're going through a medical crisis, or they maybe have lost a job and they need to figure out how to get health coverage for their families. Those kinds of things.
All that kind of stuff.
All that stuff.
I would imagine that the need is absolutely unbelievable in and around Muskegon for these kind of services.
Well, it is. I mean, everybody goes through bouts of needing, maybe some support here and then.
Yeah.
And, with the passage of the Affordable Care Act, despite the noise around it, people have opportunities to get health coverage, which is the first step. And then you can, not have catastrophic medical debt when you need to go to a provider or your blood drawn, things like that. But we really focus on the social determinants of health. So the things that would keep somebody with maybe like diabetes or congestive heart failure, keep them equipped with the things that they need to be healthy and be able to work with their physician.
To manage the cold medicine. You got anything to fix me? I could use it.
There's cold medicine.
I'll bet. So you can help manage conditions. You can help. Is this a referral service? Do people come to you to find out? I got this problem. Who do I go see? Is it how? What's the first step? I want to come and see you.
So. Both. We do refer to other agencies. We work very closely with lots of the nonprofits in town, but we also, when you come in, we have a very robust enrollment program. So you come in and we're going to screen you and see what you're eligible for.
Okay.
So that might be a public program like you would apply for at DHS. It could be food stamps. The health system has a financial assistance program. So if you have medical debt and you're like, oh my gosh, I can't pay this bill. I don't know what I'm going to do. Don't ignore the mail. Call us.
Right.
Or call the hospital. They'll get you over to us. But to make sure that you have what you need to move forward. We also have a very big pharmaceutical access program. So do not take your medications if it's because it's a $35 copay and that's stretching your budget if you're on a fixed income or you don't have coverage. Absolutely come see us.
It's hard to believe that there are those out there that can't afford the basic medications that they need.
I get it. Until I started working in this work and I was, a kid, I thought everybody had a dad with a $5 prescription card in his wallet.
Yeah, I grew up in a Teamster family, and that's remarkable health care coverage to work with that kind of thing. But that's not out there. Now, one of the things that, and I just can't get in the middle of the fight because it doesn't make sense to me, but the whole affordable health care or Obamacare or whatever you want to call it.
Yep.
To me, it seems like it was put in place to help people who really can't afford the health care in other ways, and they don't have the option to get that kind of insurance. Is that something that you guys would say you're experts in? The affordable health care thing to kind of help people navigate their way through it?
I would. There's a group in the community. Muskegon is really good at community.
Yes.
And we have a local coalition called Enroll West Michigan, the Health Project, the Health System, Hackley Community Care, Muskegon Family Care, Goodwill, Community Mental Health. We all came together and sat down last year and we said, the health insurance marketplace is opening because it opened last fall. That's the Affordable Care Act. And we want to make sure that people have the information they need to get health coverage.
Sure.
And so we wanted to have the the same messaging and we wanted to all be on the same page. And that group continues to meet. And there's tons of noise about that topic. And so we don't listen to it. We make sure that people know who they can ask when they want help to get health coverage, where they can go, and somebody will sit down with them and help them actually get it. And if you're not eligible for that, maybe you're eligible for the expanded Medicaid program, the Healthy Michigan plan. So it's really just making sure that you have the coverage that you and your family need so that you can go to the doctor when you need to.
Yeah.
It's pretty simple.
Or forced to.
Yes.
Some of us don't like to go to the doctor all that much.
Well, if you have a spouse that'll force you, that's good too.
I've been known to have that happen. Let's talk a little bit about the other services that you offer. You can help people guide their way through the Affordable Care Act and all this other stuff. Do you offer classes for better living, health prevention, all that kind of thing?
Well, we have a big program that we're working right now, and it's one of my favorites because it's so diverse in terms of who's participating in it. But Muskegon was awarded a very large federal grant a couple of years ago through the Centers for Medicare and Medicaid, and we started a program. It's called Pathways to Better Health.
Okay.
The health project's involved, and many of the groups that I mentioned a minute ago are involved. And what it does is it deploys community health workers who are individuals who really know how to navigate our community.
Yeah.
And they're working with people who have 2 or more chronic diseases and have Medicare or Medicaid, or maybe are potentially eligible for it. And they are helping them connect to classes. They're helping them understand how to manage their chronic disease. They're helping them, get to a safer environment if that's needed, things that will really help stabilize them so that their chronic disease is not managing them.
So some of the chronic diseases in and around Muskegon, what are some of the big ones that people are facing?
Diabetes, heart disease, obesity. Mm-hmm. So, the big 3.
What are you looking at me for when you say
I'm not looking at you.
I'm just kidding.
You're the only one in the room.
Hey, I'll be the first to admit it. I could do a heck of a lot better when it comes to eating and nutrition and all that kind of stuff.
You and me both. That's
Everybody.
Why, yeah.
I mean, it's just one of those things that people kind of put on the back burner a lot because of either bad eating habits or bad hours or just a crazy busy life.
Well, and it's more expensive to eat healthy.
It is.
You don't know any differently.
It is. Well, I do know differently, and I've got nobody to blame but myself. So shame on me. Where can people go to find out a little bit more about all the work that you do?
They can go to the Health Project website, so www.mchp.org.
Okay.
Or they can look us up on Facebook, which is probably more up to date than our website right now.
Doing a little work on that, right?
Doing a little work on
it.
Or they can call our office. We actually have an office in Muskegon, downtown, corner of 6th and Western.
Okay.
And we actually, last fall, opened an office in Shelby.
Oh, wow.
So real excited about working with Oceana and really getting established up there. It's a smaller office, so if you get the voicemail, leave a message, we'll get back to you.
Still a great resource for everybody.
Great resource.
The Health Project here in Muskegon. Stevi Riel, thanks for coming in.
Thank you.
And you know what? We'll put this all up at MuskegonRadio.com. We'll put all the links and all that stuff so everybody can come a little bit later on and find out what you guys offer.
Great. Thank you so much.
Hey, you know what? And it all starts just like we talked about at the beginning of this interview. I share something about a garage sale going on for a guy that needs a heart transplant. You jump in and say, hey, I can help. And then then you just tell me that this family's on their way in to see you guys soon.
That's what I hear.
Nice.
Yeah.
Amazing how that community thing works, isn't it?
Everything crossed.
Love being that.
Yes.
It is great to have you here, Stevi, and the door will be open for you.
Thank you for having me.
Absolutely. The Health Project, you can learn more about it online at MuskegonRadio.com in moments. Right now, Kim Mitchell telling you to go for a soda. Muskegon's 100.9.